So next one is we are going to discuss about the carpal tunnel syndrome. So if you see the definition, is a painful condition of the is a hand and also fingers caused by the excessive pressure on the median nerve at the front of the wrist. So here the median nerve is going to be affected in the volar compartment of the wrist. So if you see the carpal tunnel is a narrow passage on the palm side. So the wrist made with the bones and ligaments. So if you see the same thing just now, what we see the first compartment. So this is the carpal tunnel here is going to be. So the sheath here, if you see the cross section of the wrist, so here are going to be all the compartment, all the like carpal bones are there and median nerve. So here is going to be medial nerve. So this is going to be the carpal tunnel. So if you see the fingers flexor tendons, so all the tendons are there, and also different, all the tendons are there, blood vessels, nerves, and bones all together, and also flexor retinaculum. So this is like a compartment is small, but if any abnormality in any bone or ligament or tendon or nerve or anything or blood vessels, so what happened? This compartment is going to be packed, is going to be because of the swelling, the compartment is going to be packed. That means it's going to get the tightness or swelling. If, for example, if any compartment, if you imagine any train compartment, if the train compartment capacity is 100 people, if they enter the 200 people, how the compartment will be is going to be compressed. Same like here our hand also, if any swelling in the muscles and also flexor retinaculum or maybe tendons and ligaments, if anything happened to our bursa, so anything happened to these soft tissues, so may chance to get the swelling and also it compressed to the median nerve, it gives the severe pain. So this median nerve which controls the sensation and also movement of the thumb and also first 3 fingers. So if you see here, so this area is supplied by the median nerve, thumb and also the index finger, middle finger, and half of the ring finger. So this is going to be supplied by the median nerve. The remaining little finger, half of the is going to be the ring finger is supplied by the ulnar nerve. So this part is going to get the affected, loss of like a sensation and also loss of movement will happen in case of the injury of the median nerve. So when it pinched or compressed, the result is numbness, tingling, and weakness or pain in the hand. So it is called as carpal tunnel syndrome. So because of the compression of the median nerve, so this area is going to be the thumb, index finger, and also middle finger. Half of the ring finger is going to be affected with numbness and tingling sensation and also pain in the wrist joint. So it is called as carpal tunnel syndrome. Carpal tunnel syndrome. Carpals means the wrists. So that's the bones in the wrist joints. So the bones are called wrist. So carpals means we call it the wrist joint. Tunnel means, so the tunnel is there. So the fibrous tissue is there, flexor retinaculum. So in the tunnel, so these structures are there, is going to be inflamed and also is going to compress this median nerve. So if you see here, so between here, so this the tunnel, the above, if you cross section, if you open this, the fibrous tissue, flexor retinaculum. So this yellow color is the nerve. So this nerve supplies to the thumb, index finger, and also middle finger, and also half of the ring finger. So this area is going to be affected. So this carpal tunnel is located at the palm side of the wrist. The floor and also side of the carpal tunnel are formed by the 8 carpal bones. So and also roof of the tunnel is a tough piece of the fibrous tissue called as the transverse carpal ligament. So this transverse carpal ligament is there, so is also affected. So this transverse is going to be, if any swelling or if you see this is going to be the floor is going to be formed with these 8 bones. So these 8 bones are the 2 rows. So this is a pisiform and also is going to be the triquetrum and lunate, scaphoid, and also hamate. And also we can see the capitate and trapezoid and trapezium. So these 8 bones are there. So here if you see the 8 bones, so these are the carpal bones and also inside all the tendons. So if any swelling occurs, so this becomes the packing, the total compartment is going to be tightened. So because of this tightness, this will get the compression of the median nerve and also it gives the severe pain, numbness, and tingling sensation. So who are going to get this compartmental carpal tunnel syndrome? Especially who are using a repetitive task the injuries or who are participating repeated tasks such as the mouse application, just now what we discussed about the tenosynovitis. So same symptoms who are using like a phone or who are using the desktop and the system, or like a cooking activities and also household chores, or maybe who are who are using the like a cloth wrenching activities, or any like a plumbers who are using the screwdrivers, mechanics. So those people are going to use the hands like repeatedly. So it may chance to get the wear and tear or may gives the injury and inflammations. It gives the severe pain in the median nerve injury. So it at the wrist joints. So and also is going to get the during the typing. So this position is going to be altered. So may chance to get the inflammation and also swelling. So who are using like repeated injuries or repeated activities, so those people are going to be prone to get the carpal tunnel syndrome, especially the keyboards and also plumbers and also screwdrivers, mechanics. So those people are going to be affected. So what are the symptoms of the carpal tunnel syndrome? So the symptoms are going to be the numbness, tingling, and also pain in the thumb and index and middle finger. Especially these particular regions are going to be affected. So especially the mid, so this part is going to be affected. So the lateral, so that is the lateral part of the hand is going to be affected. Thumb, index finger, middle finger, and also half of the ring finger is going to be affected. So as symptoms worsen, people may find it difficult to close the hands to into a fist or grasp some small object, perform other manual tasks with their hands. So with the small activities also, they are unable to hold any objects, or maybe it's difficult to do the any activities with the hands, and also the manual like a task, any special task with the hands. And even those, if they're unable to carry the small the weights or weight carry, also unable to perform the small activities with the hands. They may also feel increased tingling also during the day and also marked decreasing the strength of the grip. So if the day progresses, so they are going to feel the sensations and also numbness and tingling sensations, and also they feel the weakness in the grip. So these are the symptoms of the carpal tunnel syndrome. So especially the other symptoms are they may chance to get the weakness in the grip, especially the grip muscles. So it will unable to carry the any weights or unable to hold any small objects also. So these are the difficulties who have got the carpal tunnel syndrome. To notice weaken the your thumb and also the first two, and it maybe is too difficult to make its first are also fist are also grasp objects. Any activities while holding the pen, or maybe it's like a gun movement. This one is holding any vessels, any spoons while cooking, or if they're carrying the any books or any small object, if they are unable to hold the like a glass. So these things also may chance to get the pain in the especially in the wrist regions. So sometimes if they are unable to hold the objects, so they may drop the things, and also it's very difficult to do the day-to-day activities. So it disturbs all the activities in the functionally. So and also the other symptoms of some people feel like their fingers are swollen, or they may have trouble the distinguish between the hot and cold also. So because of the inflammation of these structures, especially in case of who already like pregnant people or in the hyperthyroidism people, so may chance to get this type of complications. So because of these things, if anybody get injury to the nerve, median nerve, so sometimes unable to like a differentiate the which one is the hot and also which one is the cold. So it may lose the sensations. So because of the compression of the median nerve. So what are the causes for the carpal tunnel syndrome? So who are going to get this carpal tunnel syndrome? So there are usually, it's not a one definitive cause for the carpal tunnel syndrome. So there is no exact cause for the carpal tunnel syndrome. So just now we discussed about the tenosynovitis, the same symptoms, how they are going to get the symptoms in the causative factor for the tenosynovitis, who are using the mouse or knitting, or maybe you are using a scissor, or maybe in case of the, like a typist, or who are pressing the more prolonged time in the, for example, in this one on the table, if they're pressing the volar compartment, if the clipping here, if they're typing continuously. So because of the compression of the median nerve at the wrist joint, so it may use the pressure over the nerve, it may use the carpal tunnel syndrome. So because the carpal tunnel is a narrow and rigid anytime, so and also anytime there is a swelling or inflammation in the area, the median nerve can be compressed cause the pain. So because of the compression of the median nerve, so is due to inflammation or due to infection or due to systemic like changes, so may give the swelling in the median nerve and compression of the median nerve, and it will give the loss of sensation and loss of functions, and also it may give the difficulty in the movement. The symptoms may be present in one or both hands are going to be developed. Usually symptoms develop in the dominant hand first, then it affects to the other parts. Especially in case of the pregnant women, so may chance to get the this especially these type of both hands may chance to get in the pregnant women. So if you see the causative factors compare with the men and women, the ratio is, but in the women, the ratio is going to be 3 times more than the men. So because of the household chore works or these household activities are going to be more involved with the females activities. So because of the like a continuous repetition activities in the kitchen or maybe the household chores, so it may use the repeated injuries at the wrist joint, and also will get the pain in the wrist joint. And also other conditions such as the diabetes, who are having the diabetes, so all the systems are going to be involved. So because of the diabetes also may chance to get the peripheral nerve injuries. So most commonly who are get the diabetes because of the increase the blood sugar levels, so it may give the diabetic neuropathy. So because of the diabetic neuropathy also, so may chance to get the median nerve compression, or may chance to get the median nerve involvement. So it gives the carpal tunnel syndrome. And also in case of gout, so in gout also is it's inflammatory diseases, and also is also one of the causative factors for the uric acid, excessive accumulation of the uric acid levels also. So it may use the swelling in the joints, and also because of these swelling and the inflammations, so may chance to get the compression in the median nerve. So these also produce the severe pain who already having the joint pains. And also in case of the hypothyroidism, also is because of any imbalance, especially the hormone thyroid level, if they decrease the thyroid hormone levels, so it may give the systems change. So it may also called as is a mixed edema. So in these conditions, so in this hypothyroidism, the patients may chance to get the obesity, the weight gain is going to be happening because of the hormonal imbalance. So because of the increasing the weight, so the fat deposition or the water accumulation, the swelling may happening. So the major symptom in the mixed edema is going to be the puffy face, and also the body become the rounded shape. So because of this swelling and also because of this edema, so it may give the swelling in the wrist joint. So it may compress the compartment. So that means the median nerve is going to be compressed. So it's also one of the causative factors for the carpal tunnel syndrome. And also next about the rheumatoid arthritis. So it is rheumatoid also is inflammatory joint diseases. So because of the inflammation of the joint diseases, may chance to get the inflammation in the flexor, especially in the wrist joints. So because of the inflammation, the swelling may happen. It may compress the median nerve. So and also especially this radial rheumatoid arthritis is going to be involved to the small joints involvement is more. For the initially the small joints are going to be affected than the larger joints. So these distal joints are going to be affected. So that means the toes and also phalanges and wrist joints are going to be affected. So then it's going to be the shoulder joint and also elbow joint is going to be in the chronic conditions. So in those conditions who are having the like a rheumatoid arthritis, so may chance to get the compression of the radial median nerve, so it may give the carpal tunnel syndrome. And also another causative factor is the pregnancy. So because of the physiological changes, the women may chance to get the more than 13, like 11 to 13 kgs of the body weight increased during the pregnancy. So because of the increasing this weight gain, so because of the weight gain, so may chance to get the edema in the wrist joint. So because of this edema formations, it may compress the tissues in between the flexor retinaculum. So maybe the compartment syndrome, and also carpal tunnel is going to be tightened with the swelling, as well as in these conditions the median nerve is going to be compressed. And also in case of any sprain or fracture of the wrist joint, in case of any injury, any fallen outstretched hand, or any like a sports activities, so may chance to get the like a sports any like a weight, like a shot put throws, or any javelin throw, that means any disc throw. So these are the sports activities also may chance to get the compression because of the repeated injuries. So and also may chance to get the like a carpal tunnel syndrome. So what happened if we won't get any treatment for the carpal tunnel syndrome? So the main symptom just now we discussed the pain and numbness and tingling sensation, loss of movement, and also is going to get the muscle weakness. So if it is not treated properly, so what happened? The muscles are going to be, so is going to be compensating the movements. So it's stopping the wrist movements. So because of the decreasing the activities in the wrist joint, so the muscles become lost the properties. So that means, and also the muscle size, and also the muscle, because of the decreasing the activity of the wrist joint, it may decreasing the blood circulation to the particularly to the wrist muscles. And because of there is no blood circulation to the wrist muscles, there is no oxygen supply and nutrient supplies to the muscles. It leads to the muscle size is going to become thinner. So because of the muscle become thinner, so it gives the atrophy, the muscle size becomes very thin. So because of the weakness of the muscles. So these are the major complications in the carpal tunnel syndrome. So how to check, how to diagnose the carpal tunnel syndrome? So we just now we discussed. So these things are, we are going to do the special test. So these special tests are called as the Tinel sign, and also Filings test. Tinel sign means with a reflex hammer, if we tap over the median nerve distributions. So if the median nerve distributions, so it's going to give the tingling sensations. For example, the median nerve coming from the brachial plexus. So if you come to the brachial plexus, so it's going to the median nerve supplies to the, especially these three fingers. So if you tap over the median nerve distributions from the, for example, the wrist joint, if you tap on the nerve distribution to the thumb and also index finger and also middle finger, so with the reflex hammer, so the patient is going to feel the tingling sensations. So it indicates the Tinel sign positive. For example, normal person, if you tap on the wrist, over the wrist joint and also medial nerve distributions, so the normal person is not going to get any tingling sensation and also no numbness. But who are having the compression of the median nerve, so this is going to get the numbness and also tingling sensation. And also another special test is called as Filings test. So this Filings test is going to be, so we can ask the person is going to do if you do the flexion movements of the wrist joints, the both sides. So this is going to do the Filings test. So this is going to be, it gives the numbness and tingling sensation. So because of the flexion of the wrist joint here, so we is going to get the compression of the median nerve in the wrist joint. So it leads to the tingling. Because of the compression, the major symptoms are going to be tingling and numbness. So if anybody, like if you do the special test, if anybody positive with the tingling and like a numbness, so it indicates the positive carpal tunnel syndrome. So these are the two special tests. And also other than this test, we can give one more test also, reverse Filings test. So reverse Filings test also ask them to do in the stretching of the extension of the wrist position also. This position also, they're going to get the stretch in the median now. It gives the numbness and tingling sensation, both during the compression, that is a Filings test, and also this one is the reverse Filings test. Here during the in the distribution of the radial nerve, distribution of the median nerve is going to get the tingling and numbness. So this is the special test. With this special test, we can easily identify is the person having the decorneous disease or tenosynovitis and also carpal tunnel syndrome if we do the special test. So that is the differential diagnosis. We can do it with the special test. And also next one is the electrodiagnostic test. So these electrodiagnostic tests are nothing but is the nerve conduction studies. So NCVs, so we can check how is the conduction is there. So is the nerve in the median now? So how is the conduction is there? The normal conduction or any delayed conduction? How is the response? So we are going to do some neurological examinations, nerve conduction studies, as well as the electromyography. So these are going to use this electromyography. The 5 needles are going to insert into the muscles to measure the electrical activity and also assess the damage of the median nerve. So for example, these muscles are going to, these muscles are especially the thenar muscles are supplied by the median nerve. So these muscles are going to, for these muscles, if we insert this electromyography, the needles are going to insert into the muscles. So if we use these modalities, so we can find how is the action of the muscles. So if the nerve injury, so the myography, the muscular activity is going to be decreased. So then we can easily understand how much the injury is there in the median nerve. So with this special test, so we are going to identify and also we are going to, the severity of the nerve injury, we can identify with the special test. That is nerve conduction studies and also is EMG studies, that is electromyography. So especially in case of if anybody complain these things, if you go to the any like a orthopedic surgeon or the general surgeon, or maybe especially neurosurgeons. So most of these nerve conduction studies, electromyography studies are going to conducted by the neurologist. So if anybody complain, so if you see and visit the neurologist, so they can do the special test to confirm is it because of the any injury or any inflammations, or because of the any nerve compressions. We can differentially diagnose this and also conclude about the diagnosis. So then only we can give the treatment according to the causative factor. So what are the treatment procedures and treatment methods for the carpal tunnel syndrome? So the treatment plans is, first we have to know the causative factors. So according to the causative factors, so if we give the treatment according to causes, so we can prevent the severe complications. So if, for example, diabetes, control the diabetes, or if the hypothyroidism, control the like a hormonal with the thyroid, and also pregnancy after the delivery, they are going to get the recovery. So during the in the treatment progressions, so we have to give some precautionary measures and also some conservative management with some strap application, splint application, carpal tunnel splint. So that means if you stabilize the injury area, so prevent any excessive movements or any abnormal movements. So it may prevent the severe pain and also any abnormal movements. So that is why this carpal tunnel syndrome splint or carpal tunnel splint is helpful to reduce the pain in the wrist joint, to minimize and also other abnormal activities. And also we can give the non-steroidal anti-inflammatory drugs such as the non-NSAIDs, such as the ibuprofen, naproxen, and also along with the cold compressions, especially ice therapy and also cryotherapies. So these are going to be helpful to reduce the pain and also swelling. So along with these medications, so and also some ultrasound therapy in physiotherapy, ultrasound therapy, and also interferential therapies. That is some electrical modalities applications and laser therapy also is going to be helpful to reduce the swelling, and also it will help to reduce the pain. So these are some treatment modalities for the carpal tunnel syndrome. So in case of if it is not working properly with NSAIDs and also with the conservative management with brace applications, splint applications, or maybe ultrasound, IFT, so they can go for and also refer for the steroid injections. So these steroid injection is going to be helpful to reduce the inflammation at the flexor retinaculum and also around the median nerve. So this injection of the local anesthetics or maybe the lidocaine, that is local anesthesia, can also relieve the symptoms. So if we give the anesthesia, so the patient is not going to get much severe pain. So it's going to reduce the pain in the injury because of the swelling area. And also other things. So this is also one of the causative factors who are having the deficiency, vitamin deficiency. So especially who are having the diabetes, or also especially the vitamins such as the B6 vitamins and also B12 vitamin also helpful to improve the nerve functions. So these are some medical management. And also in case of if it is the conservative treatment and also this steroid injection fails, so only we have to refer to the surgical procedures. So that is called the transverse carpal ligament dividing. So if if the ligament is tight, so it may give the friction, it may give the compression to the median nerve. So the surgical procedure is going to give the needed in case of all the treatment procedures are failed. So here the ligament is overlying the top of the carpal tunnel is cut to relieve the pressure. So if you see here, the flexor retinaculum is going to be here. So it's going to give the band is like in the horizontal manner. So if we cut here, so we are going to give the less friction to the nerve. So we can reduce the irritation and also friction on the nerve. So we can reduce the symptoms. So that the high yield ligament will allow more space in the carpal tunnel. So he's going to, if we cut here, so what happens? So he's going to give the more space to the nerve, so it reduces the swelling and also symptoms in the flexor retinaculum. So sometimes if it is open surgeries, and also another one is the endoscopic release of the carpal tunnel. So he's going to release the endoscopic release. So sometimes the procedure is done endoscopically using a small camera. So he's going to send the small camera, the small tube. So this is going to be very small incision guided the procedure. So inserted particular region, the carpal tunnel regions. So he's going to correct where the swelling is there, the fibrous tissues there is going to resect it and also give the more space to the a median nerve. So these are the some treatment procedures, and also so what to expect after surgeries. So after surgeries, so there may be swelling and stiffness right after the surgery, and which we can be relieved by elevating the hand over the heart and also moving the fingers frequently. So we have to ask them to raise the hand up above the heart level in the supine lying positions. So if they do the finger movements, so they are going to get the swelling and also going to get the improvement in the wrist joint. And also physiotherapy is the very, very important after the surgical procedure also. That means if anybody having the swelling or any difficulty in the range of motion or any weakness, muscle weakness. So in case of muscle weakness, so physiotherapy will help to improve the strength in the muscles, or if they any difficulty in the movements or loss of movements, so is going to be improved with the special techniques in the physiotherapy. And also if any abnormality, again they may chance to get also this may chance to get with the recurrence. The pain and weakness usually resolves within the 2 months after surgery, but it takes 6 months to years to recover completely. So the pain and the everything is going to subside because of nerve injuries, but the other weakness and also strength in the muscles are going to be takes time. So at least more than 6 months is going to be happen. So it's going to take the recovery. So that is about the carpal tunnel syndrome. And also the after that also how to give the proper training. So how to hold the like objects with the hand, and also who got the injuries and proper good posture with the wrist positions, how to do the system work or computer work, and also ergonomic tools workstation, the mouse, and also ergonomic mouse also, and also if any stretching, how to give any like a soft pads, how to keep it, and also taking frequent rest breaks. So while doing while the, giving the anyway like activities, so at least should not give the continuous work in between, at least 5 minutes break every 1 hour, so it may at least we avoid the stress on the flexor retinaculum and also median now. And also change the position throughout the workday. So if it is the changing the positions, so we can prevent the and also so irritation on the tendons, so we can prevent the friction over the median now. So that is about the management of the surgical management, medical management, and also conservative management with the physiotherapy. And also this is about the carpal tunnel syndrome. Hope you understand clearly. If you have any doubts, so we can then discuss in the next class. See you in the next class. Thank you very much.